Adolescents probably do not get to contribute to their mental health care as much as they do to other things, like other illnesses. And part of the reason for that is actually certain state laws. So the Florida state law actually says that kids cannot consent to their own antidepressant medication treatment. So if a kid wants to start an antidepressant medication and the parent doesn't, we can't do it. Kids can't admit themselves to a psychiatric hospital because they're depressed or suicidal. The state law actually says that kids under the age of 18 are disabled. That's what the law says. Some parents might refuse to treat depression in their children because they don't understand what depression is. Some parents might not realize depression is a legitimate medical illness. So what that means is we have to work with the parents a lot on why we think treatment is important. With depression, I think it's very difficult because it's almost like an invisible illness. It's very difficult to just see symptoms of it. If you have an asthma attack, you're gonna see your kid coughing or not breathing. It's hard to see depression. And sometimes when we talk to parents about what's wrong with their kid, they don't see it because depression is invisible and depression makes kids feel like they have to keep it a secret because they feel ashamed. And that can actually make depression worse. So like not only are we not treating depression, but we can actually be making it worse by not listening to when kids tell us how bad they're feeling and by ignoring their requests for help. But we really need to fight for the kids. The kids are the ones who are suffering and the kids who are the ones who are dying. I don't think people realize that depression kills. You know, people always say that, you know, people die from suicide. That's really depression. So if we view depression like any other illness, we should be able to talk about it like any other illness. We should talk about the risks and benefits, but we should also hold people accountable for getting treatment. And if you have a kid who's suffering with an illness and they ask for treatment, we should find a way to get that kid treatment.